It is the one thing that millions of parents across the country are waiting for, a vaccination for COVID for their children. And finally, an emergency use authorization has come in for Covaxin, but of course it is awaiting the approval coming in from drug controller. The green light right from the vaccine panel marks a huge step as far as kids getting vaccinated in our country is concerned. Take a look at all the latest. India is finally getting a COVID vaccine for children. Bharat Biotech's Covaxin is recommended for emergency use approval in children between 2 and 18 years of age. The Subject Expert Committee on COVID-19 has submitted its recommendation to the Drugs Controller General of India for a final clearance. Bharat Biotech has completed Phase 2 and Phase 3 trials of Covaxin on kids below 18 in September and submitted the results early this month. The Made in India vaccine will be administered in 2 doses with a gap of 20 days between the first and second jab. But the emergency use authorization is subject to certain conditions. Bharat Biotech will continue its study as per the approved clinical trial protocol. It will have to provide the updated information, summary of product characteristics and fact sheet. The firm should submit safety data, including the data on side effects, every 15 days for the first 2 months. After 2 months, safety data must be submitted every month. While India gets its first vaccine for kids, global acceptance of indigenous vaccine is still awaited. The WHO is still to grant emergency use authorization to Covaxin. Bharat Biotech has submitted all the data required for the listing to the WHO and approval is expected this month.
We are in the process. So we are doing whatever the WHO wants it. We are fulfilling all the requirement. It's a process of the regulatory system. So we need to understand. And we both have, we have 6 vaccines WHO pre-qualified. It's not that we don't know the field.
Vaccination for all is what is the aim. So that is a very good thing that now we have got a vaccine approved for about 2 years of age. So what it can have the plus side is that you can send the children outside.
In August, India had granted emergency use approval to Zycov-D's COVID-19 DNA vaccine for children between the age of 12 and 18. With Sneha Mordani in New Delhi, Bureau Report, India Today. I'm being joined on this broadcast by a very special guest. 8-year-old Ishanvi Samdani joins me with her parents, Dr. Prateet Samdani, who's a COVID specialist from Breach Candy Hospital, and Dr. Ruchi Gupta. She's a nephrologist practicing at Bhatia Hospital in Mumbai. First up, let's begin with Ishanvi. Ishanvi, have you heard the good news about children getting vaccinated? What have you heard about vaccinations, Ishanvi?
What I've heard is that ever since I was a small girl, I've been getting vaccines on my hand, foot and mouth. The vaccine is used to protect me. I am really excited that the vaccine has come for me.
Oh, very nice. So will you take the vaccine, COVID vaccine, Ishanvi, if your mom and dad allow?
Yes, I will be very happy to take the vaccine.
Ishanvi, do you have any concerns about the vaccine right now? Anything you would like to ask doctors? Your parents are doctors. Any questions that you have about the vaccine?
If the whole world is scared not of the needle, of the side effects, they are laying an example for us children to take it. Why don't they take it themselves?
Right. And do you think, Ishanvi, the vaccine is going to help you in the fight against COVID?
Yes, I think it will help me.
It will help you. So you're going to definitely get the vaccine, Ishanvi. I'm going to take this across to your mother as well. Dr. Ruchi Gupta, at this point, what are the concerns that you have when it comes to children getting vaccinated? Your child is older. She's 8 years old. She's super excited to get her jab. But what about the ones who are 2 years old? What are your concerns right now?
Hi, Jyoti. Thanks for having me. See, ever since the child is born, we vaccinate our children right from birth over the years. And I feel that vaccination is an integral part in preventing diseases. So I feel we should not have any concerns and reservations regarding the COVID-19 vaccine. And it should be administered to all, because definitely people, as we've even seen in adults who have been vaccinated, get a milder form or do not get the COVID-19. So it is in the fight for against COVID-19. I think it is very important that we take this step ahead.
And you know, you're a mother. Ishanvi is super excited about getting the vaccine. Will you let Ishanvi go ahead and get the jab?
Absolutely. I will definitely take her forward, and I will definitely want her to get the jab as soon as it is made available for us.
Ishanvi, your mother's given you a go ahead to get a vaccine. Are you scared of anything, or are you all game for it?
Daddy, all I'm scared of that the symptoms that will be there, but I'm gonna take away my scares and I'm gonna look at the positive side that I won't get COVID.
Oh, that's very cute. You're going to look at the positive side. Every kid watching this today needs to see the positive side. Dr. Samdani, you know, you're a COVID specialist. We do know that there is a chance of thrombosis, etc., that we've seen in adults after getting vaccinated by certain vaccines. I'm not saying particularly Covaxin. Would you have any kind of concerns like this when it comes to children? Would you like the drug controller to wait before they give the final nod, or are you welcoming this emergency nod that is coming?
This is a big welcome from our side, and I'm sure this is a huge welcome from the entire medical fraternity. I think the drug controllers are going to keep a strict eye to see for any adverse effects or side effects in the following 3 to 6 months, especially after they get the 2 doses, which is 20 days apart. But please do remember, they've conducted trials in over 1,000 children, and this is the first indigenous made in India vaccine available anywhere in the world. No one has made a vaccine for children between 2 and 7. All the vaccines that are approved are 7, 10, 12, 15 and above. So we should be proud. Also, the efficacy is extremely similar to the adults. 77.8% efficacy in the trial groups that they had in 3 groups, 12 to 18, 6 to 12 and 2 to 6. So I think there should be no fear. I don't think the incidence of thrombosis is so high. In fact, it's negligible. There should not be any thought of not taking the vaccine. Children are so used to being inoculated. Chanti, let me tell you one step ahead. That day is not far away that a COVID vaccine, and could well be the Covaxin, would be actually a part or an integral part of the largest immunization program of the world, and that's the Indian immunization program or the national immunization program. So it's going to be almost like a part of NIP soon.
Oh wow, that sounds good. And you know, it's very reassuring when I hear it from a doctor like you who specializes in COVID, who's also a father. Ishanvi, I want to come to you. You know, when you get that jab, for the first 2 days, you might end up getting a little bit of fever. You know, there are a few symptoms here and there that you might end up feeling. And you said you're going to be looking at the positive side of it. So tell kids your age, what is the positive side of getting the vaccine and just suffering for 1 or 2 days with that mild fever that you end up getting?
I'm 8 years old, but my school, that's Cathedral, always says there may be a negative side, but always look on the positive side. Think why it will help you.
And you know, if you get vaccinated, you can maybe take your mask off, you can go out and play with other children also. Life will come back to normal. Are you looking forward to all of that, Ishanvi?
Yes, and I'm also looking forward that if I take my vaccine, my school may start and I'll get to go to school.
And you're missing your friends? You're missing your friends and your classmates right now?
Yes.
So once you get the vaccine, you're looking forward to go back to school and go back and play with them, study with them. Life will come back to normal. You're looking forward to a better normal now?
Yes, I'm really looking forward.
That's fantastic. Dr. Samdani, one more question that I have is on the benefits of vaccinating children when it comes to COVID particularly. We've seen the benefits in adults. Where do you see the benefits in children really lie? And outweighing the benefits over the risks.
Yes, let's go to the demographics of this country. 50% of our population is less than 25, and we say 2 to 18, that's the approval. I would say a staggering 37 to 38% of the population lies in this group. This group usually don't have comorbidities. They may be mildly symptomatic. But please remember, these are the ones who can easily transmit this virus to their folks, to their parents, to their grandparents, and spread it like wildfire. So if they get protected, they are safe to go out. The children have lost 20 months of their childhood. It's a deduction of 20 months. They've lost their play. They've lost going to school, meeting friends, having virtual classes. They've just been online. So it's really important that these children get inoculated. The only way we can completely wipe off this COVID-19 is by getting the 100% of the world vaccinated. And that can only happen if you aggressively inoculate our children.
And hence, vaccinating children becomes all the more important if you want to see 100% of the population around the world to be vaccinated against COVID-19. Ishanvi, before we let you go, what do you want to tell the kids today when it comes to wearing masks, maintaining social distancing? What are the COVID protocols that they need to follow till the point they get their vaccination, Ishanvi?
First, they should wear a mask.
Okay.
Second, if we are wearing a mask, then we shouldn't touch it all the time. Means every 5 minutes you're touching it like this once to put it up, then like this to put it back on your ears. You can't do that every 5 minutes because that's one way of the virus. If it's on your hands, going to your nose, inside your mask, and then getting it.
Okay, so you should not be doing that. That's what you want to tell children. So the children, if you're hearing to this, Ishanvi says till you get your vaccine, mask up and do what Ishanvi has said you must do. Maintain social distancing. Hopefully there's a better normal awaiting for children ahead. I thank you very much for taking the time out. Dr. Prateek Samdani, Dr. Ruchi Gupta, and of course Ishanvi, thanks so much for coming on the show and talking to us as well.